I'm sure Dr. Temolo will tell us about services that are available to help with that. We have talking changes, which you can actually self-refer yourself to them and speak to somebody about the way you are feeling. Okay? I don't want us to live here without knowing that the moment you start feeling different from the way you used to feel before, the moment this feeling takes over your daily activities, that is when you should start looking at getting help. Your parents, your brothers, your sisters are the first source of good help and support for you. If they are not available, they are not there, you don't feel confident talking to them, then you can come to your GP. And as I've said, you have confidentiality with your GP, you can speak to them on your own. If you are more than 16 years old, competency is assumed, so we can actually speak to you without your parents at all. Less than 16 years old, yes, we can actually ask them to leave because we want to speak to you by yourself. Okay? That is it for the GP. There's a lot of resources available to you which you can help, that can help improve your mental health and your mental status. The most important thing is early recognition of these symptoms, of these signs, of these changes in behaviors that you need to seek help. And the GP will speak to you and we are available to speak to you. Thank you.
I really appreciate everything you've said. I've got one or two questions, but let me start with number one. Do you have any controls or measure that maybe adult like me or youngster coming and benefit that they can use to how to manage anxiety?
Yes.
That's number one. Number two, can you distinguish between anxiety, everyday anxiety, or the one that raises concern?
Okay.
If you can just touch base on those two things.
Thank you very much for that. So, everyday anxiety, and the one, I'll come back to your second question later, which is what
controls, measures, and use them.
Yeah. So, everyday anxiety, you wake up in the middle of the night and you put on your light and you saw a shadow. And we're all scared of that. And your body says, oh, what is that? That is anxiety, you're scared. That's a fear, that's anxiety. But the moment your brain tells you and normalizes that, and you realize this is not something I should be scared of, and that's gone. So that is normal. However, when you are anxious about something, like a spider, and the spider is in the room, and you've seen it, and you totally refuse to go back into that room until somebody comes to kill it or drive it away from you, then that is abnormal anxiety. That's some sort of phobia, okay, which we can work on. There's some psychological support available to help you deal with those situations. So anxiety that makes you change your behavior, the anxiety that makes you do things that you normally not do. So you're supposed to go to a classroom, but because Mr. Hay is the teacher today, you refuse to go completely. And your brain does not normalize that to say, okay, don't worry, it's just Mr. Hay. I don't need to be scared of him. He's not going to kill me. Even if you speak on me, I don't mind. So if you're not able to normalize what should be a normal situation, those are those anxieties we need to be dealing with. So some people just don't like getting on the bus. Some people are anxious because of social pressures. Some people are anxious because of the way they look. Some people are anxious because of the way they dress. Some people are anxious because of, there's a lot of different type of anxiety, different type of situation that will lead to you feeling anxious. And anxiety is very simple. It will start very slow and creeping and grows and germinate and take all over you. And just start with a bit of a palpitation, then you have butterfly in your stomach, you start sweating, you start fidgeting, you start panicking, and you will withdraw into your shell. That is when anxiety takes over someone's life. And those anxiety are pathological anxiety that needs to be dealt with. And what do we do in that situation? I'm a GP. That's the psychiatrist over there. They've got loads of psychological techniques that they can employ or deploy to help improve, change our mindset, get you feel better and normalize those situations that you have attached to being abnormal. So there is psychological support. There are websites, in this area we've got Talking Changes, we've got Mind, we've got Alliance, we've got Impact on T-Side, which is the psychological services on T-Side that can give you the website for them that we can all tap into. And all these services are available to us. You don't need a parent to do them for you. You can actually pick up the phone or go on the website and access those services. Thank you.
Thank you so much for that. But I do have one question. We do see people that do not exhibit any form of symptom, and then before you know it, they committed suicide. They talk normally, they greet people normally. You will see them like maybe good kids and so on.
Dr. John?
But you don't know.
We are going into psychiatric realm now.
Yeah, you don't know, and the next time you hear, oh, that person committed suicide, and then people say, oh, he used to be a good kid. We didn't know that. We didn't know because he's one of the very sociable persons around. So how do we help such person when we can't even tell? He doesn't exhibit anything.
Okay. All right, thank you very much for that. Thank you. I will quickly speak about that, and then the psychiatrist will take over. Before someone will commit suicide, there will have been processes, there will be planning, there will have been things involved. Okay? And it might be very subtle, but there will have been changes in their countenance, their appearance, and the way they do things. And those are the things that might be subtle. They might come out to you and be laughing, but those that know them might know that they are not coming out in their room. They are locking themselves back in their when they live at home. They are researching stuff on the internet, and this is where cybersecurity is very important. Monitoring what our young ones are doing is very important. Again, there is no, it's difficult because there is no, one size does not fit all. Individuals present differently. But knowing those subtle changes, when they are deviating from their norm, when they stop enjoying things they enjoy, when they stop going to places that they used to go to, when they start accessing or meeting new friends, this is when we need to actually have our antennas open and like, okay, what's going on here? And when do we have to start supporting them? Okay.
Well, he's answered it beautifully. When people present, when people do have that incident of suicide, it doesn't just start immediately. There are signs that usually tend to occur. The signs can be subtle. The signs can be a form of camouflage. Camouflage in the sense that someone who's undergoing difficulties does not show it to their parents, does not show it at school, but deep within them they are struggling. And the only way they are manifesting their signs and symptoms may be when they are alone. So you will find out that for young people, they may keep to themselves in their room, but their parents may wonder, why is Timothy not coming out of his room? And that is the job of our parents, to be able to identify those subtle behavioral signs. We began to see that Saul is becoming quite very grumpy. Anything you ask Saul to do is just moody. You're wondering, Saul has never been moody before. But it's that asking those excellent question. Sometimes we shy away from asking those questions. But I guess parents aren't here, so my focus will be to talk to the young ones here. If you begin, yes, it is normal for us to be angry. As for reaction, it's normal for us to be anxious if things don't go the way we plan. But it is not normal when this becomes a everyday habit or a everyday activity. So what I'm saying is that it becomes a problem when you are anxious or your mood is low. It becomes a problem when it affects your activities of daily living. When I say activities of daily living, I'm saying you're not able to get up and bathe yourself or get up to brush your teeth. Simple things. Or the things you normally do, tidy up your room, all just messy. You're not just interested. To eat is a problem. Those are worrying signs that obviously if you see yourself in such, it's important to speak to your parents. Speak to what? Speak to what? Parents. Sometimes parents may be too busy. They may be too busy sometimes trying to get what the things you would buy, the clothes you will wear to make those money. They may be quite very, very busy. But it's important to talk to one of your parents. If you are not able to talk to one of your parents, please talk to somebody. Talk to what?
Somebody.
Okay. Now, the GP is a good one. Okay? Talk to someone. Because why am I saying this? We all have various personalities. Like some people are quite very shy. They wouldn't want to talk. They would rather want to bottle it in. I know few people who would rather talk to their best friend in class rather than their parents. When you talk to people, the essence, see, there's this myth that goes around that if you are talking about anxiety, if you are talking about depression, it's a sign of weakness. No. It's not a sign of what? Weakness. Okay? So let's talk about it. Let's talk about it. If it's something someone has done that, for example, like Bode, for example, Bode and Femi are friends, for example, and Bode sat on Femi's chair, and Bode sat on Femi's chair, and Bode refuses to stand up. As small as that issue is, it might be difficult for Femi to understand. But Bode will just say, oh, he was just only a chair. What is it? You understand? The way we all react to things are different. What I can take, you can't take it. And what you can take, she cannot take it. So let's be mindful when we interact to people around us. We should be very, very... Sometimes you might come across someone who might be autistic. The person might not know when to stop. When you are actually telling people, I don't want to play this, I don't no longer want to play, let's just stop. But they don't even understand your facial expression. Whether you are angry or you are smiling, and they just keep on. But it is us able to understand, I think we need to draw the line here. We need to what? Draw the line here. So it's important that even us as children, we should be able to study ourselves. If we are noticing things changing, please let's speak to someone. Let's speak to our parents. Let's speak to someone. Thank you.
Thank you.
Can I check, is there any questions or something anyone has written down that they want to ask? Because this is a safe space where you can ask questions. Okay? I don't want you to leave here and just say, I would have loved to ask us a question. So is there anyone that want to ask any question? Or do you need a paper to write? Or should we pass the paper around if you want to write your question? Anyone? Or we are all okay?
Okay.
If someone was autistic, can he come back to normal life? Can he be okay?
Okay, so, that's a good question. So, someone who is autistic, okay, basically, he's got autism, okay? So, autism is a difficulty where they have problems in understanding other people's emotions, okay? They have a way of doing things in a certain way, such that if they deviate from that, they become quite very anxious. Unfortunately, there isn't any cure for autism, but there are support. We have some autistic people who are doing fantastically well around the world. You see them acting in films, see them being athletes, doing well various aspects of life. So you having autism doesn't stop you from achieving your goals. There are support out there, and they have been able to, over the years, been able to work with the condition and seeking the right support for them to be able to flourish in their various activities. That was a very good question. Thank you.
Any other question?
Any other question?
Come on, you should have questions. Should we take one more question?
Yeah?
I'm looking at their faces. Yeah? Okay, go on.
Say if you see your friend that's struggling, you don't have to do that. How do you approach?
So if you see your friend who's struggling, how do you approach? Okay. First of all, that's a good identification that you've actually seen your friend not feeling quite okay. I guess the first thing is to speak to them. Speak to them and try to find out what the difficulties are. Speak to them to be able to identify. Speak to them to be able to see who they might have shared those concerns with. If they are struggling or not wanting to speak out, I guess it is not breaking friendship, but it is helping your friend in getting better. Why do I say so? God forbid you see someone quite struggling, because I've been able to see where two best friends, one went to go and climb on the railway track wanting to kill herself. Two best friends. And the other one saw it. And the other one brought her back, not able to do that attempt. She got home, she didn't tell her parents. But what the friend did was the right thing. She spoke to someone. She didn't keep it to herself. She spoke to someone. She spoke to the teachers to say, this and this happened. And from there, it was escalated, and the person got the necessary help she needed. So it's important, okay? It's not, you are not snitching, okay? This is not what we call snitching, because obviously that might just be a way for them to have even let you in, that they wanted you to know, okay? And it won't, I'm sure no one will feel good if anything bad happens and then they are thinking, I should have done something.
Yeah, absolutely.
I should have told someone. Even that enough could be a very big weight or burden to even carry for one's rest of the life. So it's important. Once you notice something, how does the see it, say it, sort it when you enter onto the train line? You see it, say it, sort it. So it's important that we identify.
So importantly from that question, what I think we should take from that is, I know your friend might confide in you to tell you what they are going through, but if you are worried about those things, then you need to escalate it. One, you can either speak to their own head of year in confidence about your concerns. Two, you have maybe their brothers, if you know their brother, you know the sister, you know their parents, you can also speak to them. You telling those ones that can look after your friend, because you're not going to be there for her all the time, is trying to help your friend. Because God forbid, if you don't say it to anyone and your friend goes ahead and do something, then that is also having repercussion on your own mental health in the future. So before we clap, I want us to normalize mental health in this room. There's no myth, there's nothing bad about mental health. I would like us to talk freely about our feeling. I would like us to talk freely about our mental situation with our parents, with our brothers, our friends, so that you can get help. We know that early help, when you seek help at the early stage, the outcome is a lot more favorable than when you leave it at a later stage. So the earlier we seek help, the better for all of us. So mental health is not cancer, but what we need to discuss freely and the way people feel about things. Okay?
Thank you.
Thank you.